I am delighted to be joined by the lovely Dr. Katarina Spies, the medical director from the Vida Fertility Institute in Spain. Hello.
Hello, Sarah. How are you doing?
Really, really well. And thank you so much for giving me some of your time this morning, because as usual, I know clinics are very busy, so this means an awful lot. Thank you.
Thanks to you for inviting me, for having this interview. It's great to see you.
Well, I wanted to have this chat with you because you did a lovely little video for us recently where you gave us a sneak peek into your clinic and into your consultation room. And we're always getting questions from people who haven't yet started IVF. And even when you think of an IVF clinic, it can be quite daunting and exciting, but also scary at the same time. So I just wanted to ask you some questions to help us, well, for you to help us get our heads around what happens in an IVF clinic. So can we start with the consultation room that you showed us? What happens in there? Because I see you've got your office, and then just outside, well, just off the office, you've then got all this fascinating medical equipment. So what happens?
Exactly. So in the consultory room, where we do the first visit, in the beginning we just talk. This is a lot about talking. So first, of course, to get to know each other, to get to know the patients, and to ask some general questions. So there I always have to ask the age, how long they have been looking for a pregnancy, if they already had any pregnancies, if they had any miscarriages, like all history of them. Then we go through the anamnesis, so I have to know if there are any diseases, personal diseases in the family, any disorders of menstruation, and so on. So this is like for me to get information, to know a little bit where to start, where to look. And then normally I first explain the basic exams we need to do, because before we start explaining any treatment, we need to know where we are, so where we part from. So for the woman, these exams are basically the uterus, to examine the uterus, the ovaries, and maybe the tubes, to see if the tubes are permeable. And for the male, and the basic exam is the spermogram. And then normally we do like a little break after these first explorations and do these exams. So what we already can do in the same moment in the clinic, we do it then. So this is where we go to the second part of the consultory, to the examination room. And there normally we always do an ultrasound. It's a vaginal ultrasound in order to check the uterus and to check the ovarian reserve. So we see both ovaries and we count the follicles. We count the small black dots, in order to explain it like this. And we count on every side in order to see how the ovarian reserve is. The ovarian reserve depends a lot on the age of the patient, and a normal ovarian reserve is more than 10 follicles in between the two ovaries. And then I show the patients. I show the female patient, and if she wants to, the male partner or the female partner can also pass and see the scan. Explain them. We see the uterus, we see the ovaries. If the patient wants to, we can also in this same moment do a pap smear. Normally patients already have it done in their home countries, because I know that, for example, in the UK, I think you do it every 3 years, but it takes us like 2 minutes to do it. We can do it in the same moment. Yeah. And then for the male partner, the basic exploration is the spermogram. And if he wants to, he can also do this during the same visit. The only thing is that there we normally demand the serologies like HIV, hepatitis B and C, at least to do it in the same day and then have the results. But really, for doing the exploration, it's not necessary to have the results. So there, I'm going to explain you later where this separate room is. And then after these basic exams, we can already talk a little bit about the different options, different treatment options, insemination, IVF, or egg donation treatment, depending on the age and on the ovarian reserve of the, and also on the treatments that they have done before. Okay.
So, you know, you were saying the first bit is just the conversation and the chatting. How soon afterwards do you do those tests? Is it on the same day or is that a separate day?
No, normally we do it on the same day.
Oh, that's
so we, when patients come to the clinic, what we try to do is like first explain a little bit, well, talk, see what we need from them, because some patients already bring some exams that they have done in other clinics or with other doctors. And then we do the exams. We can also take all the blood tests. This we can all do in the same moment. And then the second part of the talking process is like to talk about the different types of treatment. Yeah. Of course, we don't have all the results of the blood tests, but we already get some information, because from the ultrasound, from the scan, I can get a lot of information. From the sperm sample, we can also get information. So we already have, in the end of the day, quite a lot of information in order to orientate the patients to one treatment or the other.
You know, actually, the way you've just described that, it sounds so simple and so, you know, so concise. Yeah. The going and the testing and the chatting. It's actually something I wish I'd done with a fertility doctor way before I'd even considered having children. You know, I think had I had what you had just described, like in my 20s, I would have perhaps made some changes to my
exactly.
To my
exactly life. This is like the fight of the fertility doctors, with the normal gynecologists, because it's so easy to check the ovarian reserve. You do it in the scan. You always have to look at the ovaries, but you just count the follicles. And then if you see that it's a little bit in the limit or even low, you have to tell the patient, because she has to be aware of this, and then go to a clinic while there's still time to do any kind of treatment. And if she doesn't want to get pregnant in this moment, to have time to freeze, to do a social freezing of the ovaries, for example, of the eggs, for example.
Yes.
So, yeah.
Okay, so we've done the consultation room and the testing room that we saw in your video, actually. And then if it's decided that IVF is the route to go, when do the patients come back to the clinic? What happens next?
So normally the blood tests take us about 2 weeks to get the results. If you do any genetic testing, it takes us maybe 3 weeks. And this is when we normally do the second part of the consultation. If the patients live abroad, we can also do this online. So we can do a Skype conference, for example, to talk about the results and then explain the different treatment options. So normally it's about 2 or 3 weeks later, 1 month later, depending a little bit on the patients. And this is already when we can talk about the results and decide what treatment is the most interesting for these patients.
It happens quite quickly then, isn't it? So okay, so we've done the consultation in Spain, 2 weeks, and then so I could either come to you in clinic, or like you say, I can do that on a Zoom call.
Exactly. If they want to start, or if they want to stay in Spain, of course we can do the second consultation as well here, but normally it's not necessary. We can do it because it does not implicate too many exams anymore, because we already have done it. So it's just talking, and this nowadays you can do it online. Huh? Yes. So it's easier. So then we even sometimes do it with the Spanish patients, and that they don't come to the clinic, just to make a phone call or a Skype conference.
Just to make it even easier. So then stimulation would happen.
Exactly. So for the stimulation process, so if it's an insemination or IVF treatment, we normally send the patients the prescriptions online, so they can buy it in their home country, or if they want to, if after the first visit they are already interested in getting the medication and take it with them, we can also do it like this. Okay, so they can leave Spain with the medication in their suitcase, take it to the UK. And then normally the stimulation process starts also in their home countries or in Spain if they want to, and this takes us about 2 weeks of time. This is about 10 days of stimulation, of doing the hormone injection every day, and of doing scan controls every 2 to 3 days in order to see how the follicle grow, and to determine when to do the extractment, to do the egg retrieval. Okay, so what we normally recommend is to do the first part of the simulation in the home country and come to Spain for at least doing the last scan control on site, and then decide also the last blood test for estrogen and progesterone level on site, and then decide together when to do the egg retrieval. And like this, we can avoid the stress. Maybe avoid stress of traveling the day before the egg retrieval and so on.
Yes. Yeah, you know, the scans before that last key one that happens at your clinic. Where, if you're not in Spain, where would you have those scans done?
This can be done in a normal gynecological or radiological consultation. It's not necessary to do it in an IVF clinic. So normally we can also give some contacts to the patients if they don't know any doctor in the UK. They just ask us, and we can give you any contacts for doing the scan controls.
And is the room that you showed us, you know, that little initial consultation room, is that where you then do those scans, in that room?
Exactly. We do all the scans here in the clinic, in this examination room. So this is where we do the explorations in the first visit, and then in all visits. Yes. It's always the same installations.
Yes. And then now we come on to the man's part, because we get so many messages from men who are so conscious and so anxious. And they always say to us, one of their biggest fears is there being a waiting room, and then for the people in the waiting room to see them going off into a room. Because then they think everyone's waiting for them and timing how long they're in there. But is there a special...
So this... we are also aware of this. So the room where the male has to leave the sperm sample is a separated room. So it's in the surgical area, to say like this. So first we enter the surgical area where we have the waiting rooms, where we have there's the operation room, where we prepare the patients also for transfer. So we enter there, and then there's a separate room. Okay, so nobody sees actually where you go, whether you go with your partner to do a transfer, or you go to leave a sperm sample. And then what we also try is that there's a lot of intimacy, so not to make any noise, like to have it separated, and like to really be there on their own, and without anyone disturbing. I just say it like this. Yeah. If it's too uncomfortable for the males to leave the sperm sample in the clinic, there's always also the option to do this in the hotel and then bring the sperm sample to the clinic.
Okay, that's a really good alternative.
Yeah, exactly, because it's true that we always concentrate like more in the female part, but it's both. We have to take care of both patients.
Yes.
So if we can facilitate it, if we can make it easier for the male partner, no problem for us. You can leave the sperm sample in the hotel and then just bring it to the clinic.
Yes. And then, of course, we get to the crucial bit, which is transfer.
Transfer is in the operation room. So the operation room is beside the laboratory. And this we do operation room. It's not because it has to be sterile. It does not really have to be sterile conditions, but we need the laboratory to be close by. Okay, so what we do is we prepare the woman. So we put the speculum, we introduce the small catheter inside the uterine cavity. And once I'm there, once I know that everything is prepared for the transfer, I just tell the biologist, then the biologist take out the embryo or the embryos from the incubator, bring it to me for the second cannula, the second catheter, and then I just have to introduce it inside the uterus. So really it's like a 5 to 10 minutes process. Yeah, but what we need is to be well prepared in order that the embryos just get out of the incubator and inside the second incubator inside the uterus.
I always get really emotional when I talk about that because it's such an incredible moment. I can't imagine how you must feel at that point.
Yes, if you stop thinking, and this because normally, we do this like every day, but it's the most important moment, and if you stop thinking and say, okay, I probably just left pregnant this woman, this couple. So it's also emotional for us. It's beautiful. And then we also we can also, like, normally we also give them we can show them the small video in the ultrasound because we do scan controls. So we show them, look, here is the embryo going out of the catheter, it's this small white dot. And then I also normally take the scan pictures in order to give it to the patients, so they have like the first ultrasound picture.
That is incredible. I always describe it. For me, it was like looking at a starry night and then seeing a shooting star.
Exactly. It's nice. We also give them the picture of the embryo. This in the report. We have a picture of the embryo inside the incubator, and then the picture of the ultrasound, and then hopefully like 2 or 3 weeks later, the first scan.
Wow. And can the patient's partner be in the room?
Yes, of course.
Yeah.
They can be with them, because it's for both of them. And so if they want to, they can enter. And there's no blood, nothing. So they only see their partner and the ultrasound.
And then after that wonderful magical moment, obviously comes the dreaded 2-week wait when you find out if it's worked or not.
Exactly.
So does a couple do the patients come and see you again after that? Or
normally it's not necessary. So what we give them the day of the transfer, and after the transfer they rest about 15 minutes, and then we give them the instructions. We give them, if they need any prescriptions, any medication, we give them all for this 12 days of waiting. And then normally they can go back to their home country. We recommend to leave on the day after the transfer. And there they just have to continue with the medication, with more or less normal life, a little bit like avoid sport, avoid relationships. And then 12 days after we do the test. But it's not necessary to come back to the clinic. Of course, if there are any doubts, if they need to know anything, any symptoms, we are there. So they can just call us, we call them back, or I have to call them per Skype, per WhatsApp, per Zoom, whatever, without any problem.
Wonderful. Well, I have to say thank you so much for talking me through all of that. And I'd be
it's a pleasure.
I'm so intrigued. I might even ask you for another video soon. I'd love to show people what the transfer room looks like as well. So maybe we'll get you to another little.
Perfect. Whenever you want to, and also if you want to with the biologist or anything, if you need to know anything, we are here.
Yes, we love seeing behind the scenes. But
exactly.
Thank you so much for today, and I'm going to let you get back to clinic. And of course, any questions, people can direct message the clinic and get all their questions answered.
Perfect. Thank you, Sarah. And I hope to see you very soon.